Hi everyone, welcome back to my channel. Already ನಾವು health ಬಗ್ಗೆ we have studied about the health, disease, wellness, and also we studied the concept of health. In concept of health, we have studied biomedical concept, ecological concept, psychosocial concept, and holistic concept. Next, we already study about the factors in which the factors are variables. Variables means the characteristics that is differ from one person to another, in which they have two types of variables. One is internal and external variables. Other factors like biological factor, environmental factor, psychosocial factor, social environment factor, and lifestyle. And today the we will continue the unit. Today we will learn about the causes and risk factors for illness. See, there are so many causes which will cause the illness in our body. Okay, and also there are many risk factors which will produce a diseases or illnesses in our body. The main thing causes are illness results from a disease or from an injury that affects body functioning. Usually in physiological causes, there are, for example, if the person is having a diabetic mellitus, ಅವರಿಗೆ ಆ ವ್ಯಕ್ತಿಗೆ ಏನಾದರೂ ಸಕ್ಕರೆ ಕಾಯಿಲೆ ಇತ್ತು ಅಂದರೆ ದೇ ವಿಲ್ ಬಿ ವೇರಿಯೇಷನ್ ಇನ್ ದ hormonal changes in which the insulin may not be produced from the pancreas. So what will happen? The person will have an increase in the sugar level. This will cause a physiological causes or psychological causes. For example, if the person is having depression, if the person is having angry, otherwise if the person is having any mental illness, he will develop some of the psychological illnesses or psychological causes. Example, he will not eat properly, he will not communicate properly, uh, he will not able to perform his activities, daily activity of living. Okay, there are multiple causative factors. First one is poor immunity. What is immunity? The immunity that will provides a strength, that will provides a health for a person. When there is a lack of immunity, he will develop a illness or he will develop a diseases. Okay, for example, as we are working in the hospital side, ನಾವೆಲ್ಲ ಹಾಸ್ಪಿಟಲ್ ಸೈಡಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಏನಾದರೂ ನಮಗೆ ಇಮ್ಯುನಿಟಿ, ಏನಾದರೂ ನಮಗೆ ಪವರ್ ಅಥವಾ ಏನಾದರೂ ನಮಗೆ ಶಕ್ತಿ ಕಮ್ಮಿ ಇದ್ದರೆ ನಾವು ಚೆಕ್ ಮಾಡಬೇಕಾದ್ರೆ ಪೇಷಂಟ್ಸ್ ಬಿ ಪಿ ಚೆಕ್ ಮಾಡಬೇಕಾದ್ರೆ ಟೆಂಪರೇಚರ್ ಏನಾದರೂ ಇದಾದಾಗ ಅವರಲ್ಲಿರುವಂಥ ಮೈಕ್ರೋ ಆರ್ಗನಿಮ್ಸ್ ನಮಗೆ ಅಟ್ಯಾಕ್ ಮಾಡಿ ನಾವು ಸಹ ಕೋಲ್ಡ್ ಆಗೋದಾಗಲಿ, ಹೆಡ್ಏಕ್ ಬರೋದಾಗಲಿ, ಫೀವರ್ ಬರೋದಾಗಲಿ ಅವೆಲ್ಲ ನಾವು ಡೆವಲಪ್ ಮಾಡ್ಕೊತೀವಿ. ಸೊ ದ ಇಮ್ಯುನಿಟಿ ಪ್ಲೇಸ್ ಆ್ಯನ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್ that will prevents the causes of illness. Okay, a good so we should have to develop a good immunity through the good health. Next one is poor health. However, nowadays we having a poor health situation. For example, everyone is developing a drinking alcohol, and they will develop a smoking, ಆಲ್ಕೋಹಾಲ್ ಆಗಿರ್ಬೋದು, ಸ್ಮೋಕಿಂಗ್ ಆಗಿರ್ಬೋದು. ನೆಕ್ಸ್ಟ್ ದೇ ವಿಲ್ ಆಲ್ಸೋ ಹ್ಯಾವ್ ಎ ದೇ ವಿಲ್ ಟೇಕ್ ಎ ಡ್ರಗ್ಸ್ ಆಲ್ಸೋ. ದಿಸ್ ವಿಲ್ ಮೇಕ್ಸ್ ದೆಮ್ ಟು ಹ್ಯಾವ್ ಎ ಪೂರ್ ಹೆಲ್ತ್ ಕಂಡೀಷನ್ಸ್. ನೆಕ್ಸ್ಟ್ ಒನ್, ಅಕ್ಯುಮುಲೇಷನ್ ಆಫ್ ಟಾಕ್ಸಿನ್ಸ್ ಇನ್ಸೈಡ್ ದ ಬಾಡಿ. ಹೇಗೆ ದ ಟಾಕ್ಸಿನ್ಸ್ ನಮ್ಮ ಬಾಡಿಲಿ ಡೆವಲಪ್ ಆಗುತ್ತೆ? ಹೌ ದ ಟಾಕ್ಸಿನ್ಸ್ ಅಥವಾ ಹೇಗೆ ವಿಷಕಾರಿಯಾದ ಅಂಶವು ನಮ್ಮ ದೇಹದಲ್ಲಿ ಸೇರಿಕೊಳ್ಳುತ್ತೆ? ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ನಾವು ಪ್ಲಾಸ್ಟಿಕ್ ಬಾಕ್ಸ್ನ ಯೂಸ್ ಮಾಡಬಾರ್ದು, ಆದರೆ ಏನು ಮಾಡ್ತೀವಿ, ಬಿಸಿಯಾಗಿ ಅನ್ನ ಆಗಲಿ, ಬಿಸಿಯಾಗಲಿ ಊಟದ ಏನಾದರೂ ನಾವು ಅದರೊಳಗಡೆ ಹಾಕಿದಾಗ ಅದು ಪ್ಲಾಸ್ಟಿಕ್ ಆಲ್ರೆಡಿ ಅದು ಸಮ್ ಕೆಮಿಕಲ್ ಮಿಕ್ಸ್ ಆಗಿರುತ್ತೆ. ಅವಾಗ ಏನಾಗುತ್ತೆ, ಇಟ್ ವಿಲ್ ಮಿಕ್ಸ್ ವಿತ್ ದ ಫುಡ್. ಸಿ, ನಾವು ಆ ಆಹಾರನ ನಾವು ಸೇವಿಸಿದಾಗ ಏನಾಗುತ್ತೆ, ದ ಟಾಕ್ಸಿನ್ಸ್ ವಿಲ್ ಎಂಟರ್ಸ್ ಇನ್ ಅವರ್ ಬಾಡಿ. another example, farmers, what they will do, the farmers, when they do a ಸ್ಪ್ರೇ ಮಾಡ್ಬೇಕಾರೆ ಅವರು ಇನ್ನು ಸ್ಪ್ರೇ ಮಾಡ್ತಾರೆ, ಇನ್ಸೆಕ್ಟ್ಸ್ ಏನೂ ಬರಬಾರ್ದು ಅಂತ ಆ ಗಿಡಗಳಿಗೆ ಫಾರ್ಮರ್ಸ್ ಏನು ಮಾಡ್ತಾರೆ, ಸ್ಪ್ರೇ ಮಾಡ್ತಾರೆ. ಅದು ಸಡನ್ನಾಗಿ ನಮ್ಮ ದೇಹದೊಳಗಡೆ ಹೋಗಿ ಸೇರಿಕೊಂಡಾಗ ದ ಟಾಕ್ಸಿನ್ ದಟ್ ವಿಲ್ ಅಕ್ಯುಮುಲೇಟ್ಸ್ ಇನ್ ದ ಬಾಡಿ. ಆವಾಗ ಅದು ಲಂಗ್ಸ್ ಒಳಗಡೆ ಹೋದಾಗ ಇಟ್ ವಿಲ್ ಡೆವಲಪ್ ಸಮ್ ಆಫ್ ದ ಬ್ರೀತಿಂಗ್ ಡಿಫಿಕಲ್ಟೀಸ್ ಆಗಿರ್ಬೋದು, ನ್ಯೂಮೋನಿಯಾ ಆಗುತ್ತೆ, ವೆದರ್ ದೇ ವಿಲ್ ಡೆವಲಪ್ ಎ ಸಿವಿಯರ್ breathing difficulty. So this will also makes to accumulation of the toxins in our body. Next one is exposure to the microorganisms. ಈಗ 2019 ಇಂದ 2020 2021 ಅಲ್ಲಿ ವಿ ಹ್ಯಾವ್ ಎ ಕೊರೋನಾ. ನಮ್ಮ ಇಡೀ ವರ್ಲ್ಡ್ ಫುಲ್ ಕೊರೋನಾದಿಂದ ಸಫರ್ ಆಗಿದೆ. ಬಿಕಾಸ್ ಆಫ್ ದಟ್ ಮೈಕ್ರೋ ಆರ್ಗನಿಸಮ್ ವೆನ್ we are exposing, because as a nurses we are doing our duty in during the time of corona period. When we are exposed to that condition we will also get the corona. So ನಾವೇನು ಮಾಡ್ತೀವಿ, we will have a ppe kit we are having, and we will maintain a safety precautions. ನಾವು ಈಗ ಪೇಷಂಟ್ ಹತ್ರ ಹೋದಾಗಲೂ ಸಹ we will maintain a precautions. Why? To make minimal exposure to the microorganism. And the last one is poor thoughts. Because ನಮಗೆ ಯಾವಾಗ ಸರಿಯಾದ ನಾಲೆಜ್ ಇರಲ್ಲ, ಯಾವಾಗ ನಮಗೆ ಸರಿಯಾದ ಥಾಟ್ಸ್ ಇರಲ್ಲ, ದಟ್ ವಿಲ್ ಆಲ್ಸೋ ವಿಲ್ ಡೆವಲಪ್ ಎ ಇಲ್ನೆಸ್ ಆರ್ ಡಿಸೀಸ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ನಾವು ಈಗ ವೆನ್ ವಿ ಗೋ ಫಾರ್ ಎ ವಾಶ್ರೂಮ್ ಆರ್ ವೆನ್ ಯು ಗೋ ಫಾರ್ ಎ ಟಾಯ್ಲೆಟ್, ವೆನ್ ವಿ ಆರ್ ನಾಟ್ wash our hands, that will also because of poor knowledge ಏನಾಗುತ್ತೆ, we will not wash our hands, through that hand only we will eat food, that will also cause a illness. And another thoughts means we will expose are when you are having a poor knowledge about the health. ನಾವು ಹೇಗೆ ನಮ್ಮ ಆರೋಗ್ಯವನ್ನು ಕಾಪಾಡಿಕೊಳ್ಬೇಕು, ಯಾವ್ಯಾವ ರೀತಿಯಲ್ಲಿ ನಾವು ಇರಬೇಕನ್ನೋದನ್ನ ನಮಗೆ ಯೋಚನೆ ಇಲ್ಲದೆ ಇರುವಾಗ ಸಹ ವಿ ವಿಲ್ ಗೆಟ್ ಎ ಇನ್ಫೆಕ್ಷನ್, ವಿ ಆರ್ ಎಕ್ಸ್ಪೋಸ್ ಟು ದ ಇಲ್ನೆಸ್, ಆರ್ ವಿ ವಿಲ್ ಗೆಟ್ ಎ ಡಿಸೀಸಸ್. ಓಕೆ, ನೌ ವಿ ಆರ್ ಮೂವ್ ಟು ದ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್. ಎ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ಈಸ್ ಎನಿಥಿಂಗ್ ದಟ್ ಇನ್ಕ್ರೀಸ್ ದ ವಲ್ನರಬಿಲಿಟಿ ಆಫ್ ಎನ್ ಇಂಡಿವಿಜುವಲ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಈಗ ಡ್ಯೂರಿಂಗ್ ದ ಟೈಮ್ ಆಫ್ ದೀಪಾವಳಿ, ಈಗ ದೀಪಾವಳಿ ಹಬ್ಬದಲ್ಲಿ ಏನು ಮಾಡ್ತೀವಿ, ನಾವು ಪಟಾಕಿಯನ್ನು ಹಚ್ತೀವಿ, ವಿ ವಿಲ್ ಫೈರ್ ಕ್ರ್ಯಾಕರ್ಸ್ ವೇರ್ ದೇ ಹ್ಯಾವ್ ಎ ಸ್ಮೋಕ್, ಏರ್ ಪೊಲ್ಯೂಷನ್. ವೆನ್ ವಿ ಆರ್ ಎಕ್ಸ್ಪೋಸ್ ಟು ದಟ್ ಏರ್ ಪೊಲ್ಯೂಷನ್ we will get a breathing difficulty, we will get a difficulty in breathing, or we will get a pneumonia or anything. So this will act as a risk factor. Okay, this will make us a vulnerability. See, vulnerability usually we have a under 5 and as a old age group vulnerability, they are all vulnerabilities. Under 5 means from birth till 5 years of age they will called as a under 5. Under 5 means ಹುಟ್ಟಿದ ದಿನದಿಂದ 5 ವರ್ಷಗಳ ಒಳಗಿನ ಮಕ್ಕಳನ್ನು ನಾವು ಅಂಡರ್ 5 ಅಂತ ಕರಿತೀವಿ. ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಎ ಓಲ್ಡ್ ಏಜ್ ಪೀಪಲ್ಸ್, ವಯಸ್ಸಾದವರಲ್ಲೂ ಸಹ ನಾವು ಅವರು ಬೇಗ ಏನಾಗ್ತಾರೆ, ಕಾಯಿಲೆಗೆ ಅವರು ದೇ ಆರ್ ವೆರಿ ಪ್ರೋನ್ ಟು ದ ಇಲ್ನೆಸ್ ಆಗಿರ್ತಾರೆ. ಓಕೆ, does not mean that the individual develop diseases, only increase the chance of experiencing the diseases. The most common risk factors is, first one is genetic factors. Nowadays all the middle age or all the teenage is having a disease of diabetic mellitus, hypertension, cardiac problem. Why? Because of genetic. ಓಕೆ, ನಮ್ಮ ಪೇರೆಂಟ್ಸ್ಗೆ ಏನಾದರೂ ಅವರಿಗೆ ಡಯಾಬಿಟಿಕ್ ಇರ್ಬೋದು, ಅವರಿಗೆ ಹೈಪರ್ ಟೆನ್ಷನ್ ಇದ್ದಾಗ ಬಿಕಾಸ್ ಆಫ್ ಹೆರಿಡಿಟಿ, ಬಿಕಾಸ್ ಆಫ್ ಜೆನೆಟಿಕ್ಸ್, ವಿ ವಿಲ್ ಆಲ್ಸೋ ಗೆಟ್ ಎ ಆ್ಯಂಡ್ ವಿ ವಿಲ್ ಆಲ್ಸೋ ಪ್ರೋನ್ ಟು ದಟ್ ಡಿಸೀಸಸ್. ನೆಕ್ಸ್ಟ್ ಒನ್ ಈಸ್ Physiological factor, already I said, when in our body, when there is a lack of functioning. For example, ನಮಗೆ ಏನಾದರೂ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಏನಾದರೂ ಚೇಂಜಸ್ ಆಯಿತು, ಏನಾದರೂ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಅಪೆಂಡಿಕ್ಸ್, ಯೂಶಲಿ ಅಪೆಂಡಿಕ್ಸ್ ವೆನ್ ಇಟ್ ಗೆಟ್ ಇನ್ಫೆಕ್ಷನ್ ವಿಲ್ ಕಾಲ್ ಆಸ್ ಎ appendicitis. When we get a appendicitis, the person will have a infection of the appendix, where he shows a symptoms of fever, pain in the abdomen, and anything. See, this will also produce a risk factors. Anything changes in our body, that will makes a physiological changes. For example, if the person got an accident, if he has a fracture, that will also changes in the posture or changes his activity of the daily living. See, next one is environment, parisara. The environment will play a very important role in causing or risk in developing the risk of the diseases. ಯಾಕಂದರೆ in environment, when we spoil the environment, we will prone to the diseases, or we will prone to the illnesses. Then next one is age. Already I said that under 5 and the old age people are very prone to the infection. Next, lifestyles plays a very important, because nowadays everyone is having a alcoholism, smoking, drug addiction, eating outside food, eating open food. That will lifestyles, and also too much of stress in life, occupational stress, we will tell that. Too much of stress, too much of financial problem. This all lifestyles will also will develop a risk, which will make us to prone to the illnesses. Next one is dietary habits. ಮೇನ್ ನಾವು ಯಾವಾಗ ನಮ್ಮ ಊಟದಲ್ಲಿ ಸರಿಯಾದ ಪೌಷ್ಟಿಕಾಂಶ ಇಲ್ದಲೇ ಇರೋದ್ರಿಂದ, ಆವಾಗ ಏನಾಗುತ್ತೆ, ದ ಡಯಟ್ರಿ ಹ್ಯಾಬಿಟ್ಸ್ ವಿಲ್ ಆಲ್ಸೋ ಮೇಕ್ ಅಸ್ ಟು ಡೆವಲಪ್ ಎ ಇಲ್ನೆಸ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಈಟಿಂಗ್ ಟೂ ಮಚ್ ಆಫ್ ಶುಗರ್ and not drinking proper water. See, nowadays in hospital, every patient will come with the complaints of pain abdomen and difficulty in urination, burning, micturition. Why? Because they will have develop a renal colic or renal stone. See, when we drink too much of water, we will not get a renal stone. But when there is lack of water intake, that will lead to so much of problems. Then other factors like biological factor and behavioral factor. Biological, already I said that we are according to the age, sex, everything will come under behavioral factor, because when the person behavioral mood, for example, if the person may be angry, when he is very angry, his BP will be increased. When there is an increase in BP, he will get a hypertension. Okay, another example, behavioral means, for example, depression. In depression, what will happen? The person will not communicate properly, so he will have a suicidal thoughts. See, this will also make us to prone to the illness. Next, immunological factor means immunity. When there is a lack of immunity to the any other external environment or internal environment, the person will prone to the illness. And then the last one is services, social factor, and spiritual factor. The services, example, in the remote place, there is no proper PHC or CHC, or there is no proper transportation of the patient through the 108. That will makes them to suffer a lot. So now the government of Karnataka had made, that is, every village they have a sub-center and they have a PHC, okay, where they will get a treatment. If they are not able to get the treatment, they will refer to the higher center. When these services are not available, this will make them to develop a illness. Then social factors, already social factors like poverty, lack of economical, financial problem, then the dietary problems, slum areas, that will also plays an important in development of illness. Then last one is spiritual factor. The spiritual that will helps to uh, improve our concentration. The spiritual that will helps to develop a calm situation. Okay, so this all risk factors that will make us to prone to the illnesses. Understood? Today we have learned the causes. Usually with the person having poor immunity, poor health, and any other accumulation of the toxic inside the body, and when he is prone to expose to the organism, microorganism, if he is having a poor thought, that will develops a illness. And also we studied about the risk factors when the vulnerability of an individual that will makes an increase in the risk factor. Usually we learn genetic factor, physiological factor, environment, age, lifestyle, dietary habit, and other factors. And finally we have come to the end of this unit. Already we have studied about the health. Health means it is a complete state, okay, where there is a physical, mental, social well-being will be there without any diseases or infirmity. Next one is we have studied about the factors, that is variables, biological factor, environmental factor, psychosocial factor. And today we have learned, and also we have learned the concept of health. The members are a group, they have made a concept about the health: biomedical concept, ecological concept, psychosocial concept, and holistic concept. Holistic means where we have to treat the patient as a whole, not we have to treat his problem. Okay, for example, he is having a pain abdomen. Only we should not treat the pain. We have to treat as a person. That is holistic concept. And lastly, we have learned about the causes and risk factors. Okay, so this we have completed the unit 1. And also if you have any doubts, or if you want again anything extra you want, means you can comment in the in this channel. Please study well, and kindly request that please share, like, and subscribe this channel. Next we will meet on the next unit. And finally, thank you, thank you, thank you.